Hello everybody, my name is Danielle Bridwell and I did my presentation on psilocybin and depression. Topics of study that we're going to focus on for this presentation are going to be what is psilocybin and how does it work, psilocybin as a new approach to treat anxiety and depression, increased brain function from psilocybin therapy, and the safety of psilocybin treatment. So what is psilocybin and how does it work? So psilocybin, also referred to widely as magic mushrooms, is a type of naturally occurring mushroom which contain the psychoactive compound psilocybin. So psilocybin itself isn't actually a mushroom, it is just the compound inside of these mushrooms. There are more than 180 psilocybin containing mushroom species, and there are 14,000 plus mushroom species in total in the world, so it's a fairly small number of the total mushrooms or the total types of mushrooms that there are in the world. And psilocybin is converted by the body to psilocin, and this is going to be the actual compound that produces psychoactive effects. And psilocybin has a very similar molecular structure to serotonin, which regulates mood, sleep, and stress coping mechanisms. So due to the similarity in the molecular structure between psilocin and serotonin, psilocin actually activates the same receptors that serotonin does, and there's a specific one known as the 5-HT2A, and this particular receptor mediates many different functions in our minds like mood, imagination, learning, and perception. So psilocin will sort of latch on and sit in these receptors and activate them, thereby producing the characteristic trip of magic mushroom experience, which can include change in mood, imagination, and perception. So I've just included some pictures of some different type of mushrooms that actually include psilocybin, as well as sort of the visuals of what a trip would look like and the molecular structure of psilocybin. So we will be looking at psilocybin as a way to treat anxiety and depression. Recent studies have been conducted to study the effects of psilocybin on depression and anxiety. Controlled amounts of psilocybin have been found to decrease the severity of a patient's depression and anxiety. Some of these will touch on the idea of a microdose, which is 1% of the normal dosage that would be taken on average. And we will look to answer the question of whether or not psilocybin is a good treatment for anxiety and depression. So the first study we'll look at is the effects of naturalistic psychedelic use on depression, anxiety, and well-being. So this journal isn't exactly written on psilocybin, but it does include it as one of the key parts in their study. So the research method was they used an online survey, basically just promoted it and looked for people to sign up, and the inclusion was pretty basic. It just said you're 18 plus and you had psychedelic use at least one time in your life. And then the participants rate their average depression, anxious, and mental well-being status prior to the first psychedelic use and then after the psychedelic use. So in this method, I've put some of the different tools they use to test the ratings of depression, anxiety, well-being, and these are all sort of formulated tests in order to rate each of those characteristics that I just stated. I won't go into too much detail on it, but it is referred back to in some later pictures, so feel free to pause and look at it for just a second. And then this is just a table of the demographics used for the research, which included age, sex, education, and preferred psychoactive drug of choice. Psilocybin taking the top spot, as about half of the participants listed this as their drug of choice. So getting into the results, I have copy and pasted a table here. Basically, this is the mean scores of the test I was talking about earlier from before the psychoactive use and after the psychoactive use. So the PHQ and the GAD, the PHQ would be used to rate their depression skills, and the GAD to rate the anxiety levels. So as you can see, the mean before, it started at 10.7 for depression and 9.33 for anxiety, which are on the higher end, and then post, it drops down to 4.65 and 3.59. And then the HERO, the wellness scale, increased. So this is actually a good thing, not a bad thing. Like the last thing, how it went lower was a good thing. The HERO going up from a mean score of 27.99 to 39.31 means these people rated their overall wellness as an increase between pre and post psychedelic use. So another table, this table shows the percentage of negative outcome items answered by participants. So it's just some negative outcomes that were sort of listed with the use of these drugs. And as you can see, the numbers are fairly low. The highest one coming in would be the cannabis misuse, which, as we all know, cannabis is now legal for those people who are over 21. So it's not a terrible thing. And the second one came in as cigarette smoking. But suicide rates and impulsive behavior all had a fairly low percentage. All right, and then some more results. The results of depression, anxiety, and wellness, pre- and post-psychoactive drug use. For each category, the red line will represent people who have tried to self-harm before, and the blue line represents those who have not. So, as you see where the lines start at pre-use of the psychedelics and then post, the two categories for anxiety and depression have gone down in both groups, and the overall wellness went up in both groups. So the discussion, the study did have some limitations to mention, including its retrospective design, reliance on self-report, and the inability to confirm the participants had actually taken the drugs. However, it provided a great insight into learning the connection between psychedelics and anxiety and depression. The results provided evidence to confirm the hypothesis of the interrelationship between past psychedelic use and current levels of emotional wellness, thereby providing intriguing insights into the association between psychedelic use and mental health. Psychedelic use in the population was associated with large effect size reductions in depression and anxiety and marked improvements in emotional well-being. These benefits increased with self-reported psychedelic usage, but even participants with a single lifetime psychedelic exposure reported improvements in mental health. These results point us in the direction of using psilocybin or other psychoactive drugs to treat depression and anxiety. So the second study we'll look at is increased global integration in the brain after psilocybin therapy for depression. And the research method here was that researchers assessed the subacute impact of psilocybin in the brain in two clinical trials of depression. The first was an open lab trial of orally administered psilocybin in patients with treatment-resistant depression. And they did use an fMRI to record baseline and then after they took the psilocybin to map the brain. And the second trial was a double-blind phase 2 randomized controlled trial comparing psilocybin therapy with escitalopram, sorry if I messed that up, but a drug used to treat anxiety and depression. The patients with major depressive disorder received either two 25 milligram oral psilocybin 3 weeks apart plus 6 weeks of daily placebo, or two 1 milligram oral psilocybin 3 weeks apart plus 6 weeks of daily escitalopram. fMRI was recorded at baseline and 3 weeks after the second psilocybin dose. Some more on the method. The eligibility required a general practitioner confirmed diagnosis of unipolar MDD, major depressive disorder, and people were asked to not use any medications to mix with the psilocybin or the other drug just to make sure that there's no negative outcomes. So this is just a basic chart that I copied over from the journal showing the first group versus the second group. So the first group was pretty basic. They came in, they got their scan, and then they got their doses, came back to visit, and then the end of the 6 months was also recorded. But for the second one, it can be a little bit complex, but it's basically either they received a dosage of psilocybin, two dosages of psilocybin, and then they either received a placebo or escitalopram. Results, brain network modularity was significantly reduced 1 day after psilocybin therapy. This results implies a global increase in functionality connectivity between the brain's main intrinsic networks. Decreased brain modularity for psilocybin, but not escitalopram, response to psilocybin correlates with brain network flexibility. These are some more graphs that I copied over. This image shows the reduced brain modularity in the open arm group. So the first baseline scan, we can see it's smaller. There's less connections between the post-treatment. And then we see the modularity increasing from this as well. And the same thing, this image shows the decrease in modularity after 6 weeks psilocybin treatment. The data shows a large increase within the psilocybin group and only a small increase within the escitalopram. Across the two trials, decreased brain modularity was observed and correlated with improvements in depressive symptomology. This antidepressant action may be specific to psilocybin therapy, as no changes in modularity were observed with the conventional SSRI antidepressant escitalopram. The study's primary hypothesis was confirmed and replicated despite substantial differences between the design of the two trials. Here, we identify a robust, reliable, and potentially specific biomarker of response to psilocybin therapy for depression. Our results may help to explain why psilocybin therapy holds a promise as a new treatment option in psychiatry. And the last journal we'll look at is effects of psilocybin-assisted therapy on major depressive disorder, a random clinical trial. So this randomized waiting list controlled study enrolled 27 patients aged 21 to 75 with moderate to severe unipolar depression. Participants were randomized to an immediate or delayed treatment condition in which they received 2 doses of psilocybin with supportive psychotherapy. 24 participants completed both psilocybin sessions and were followed through 12 months following their second dose. Individuals with personal or first or second degree relative history of psychotic or bipolar 1 or 2 disorder were excluded. And then they were asked to refrain from drugs before and during this trial as well. So measures of depression severity were taken on day 1 and then at 3, 6, and 12 months. At the 1, 3, 6, and 12-month follow-up timelines, participants completed the persisting effects questionnaire, which involved rating on a 6-point scale the current persisting effects they attributed to their psilocybin experiences. Results. So follow-up independent sample tests revealed significantly lower depression scores in immediate treatment condition at weeks 5 and post-session. So you can see the baseline, the grid hammer score started pretty high, and by week 5 and 8, these numbers were low, and it's important to point out that as the 3 weeks went on from week 5 to 8, they only saw a very, very small increase, so they stayed low. After the psilocybin session, 17 participants at week 1 and 17 participants at week 4 had a clinically significant response to the intervention, greater than 50% reduction in the grid ham score, and 14 participants at week 1 and 13 participants at week 4 met the criteria for remission of depression just after this psilocybin treatment. This randomized clinical trial documented the substantial, rapid, and enduring antidepressant effects of psilocybin-assisted therapy among patients with MDD. The current study showed that clinical significant antidepressive response to psilocybin therapy persisted for at least 4 weeks, with 71% of the participants continuing to show a clinically significant response at a 4-week follow-up. Psilocybin was found to have low potential for addiction and minimal adverse event profile, suggesting therapeutic advantages with less risk for associated problems. Rare psychiatric conditions are warranted. The present trial showed that psilocybin administered in the context of supportive psychotherapy produced large, rapid, and sustained antidepressant effects. The effect size reported in the study were approximately 2.5 greater than the effects found in psychotherapy. So is psilocybin safe to use? Single doses of psilocybin have been used in controlled settings without serious side effects. The most serious common side effects include confusion, fear, hallucinations, headaches, high blood pressure, nausea, and paranoia. Although information is fairly new, there is no known long-term effects from taking psilocybin. Serious side effects include seizures, psychosis, and coma. In the treatment of depression and anxiety, psilocybin should be taken in controlled amounts and in controlled setting. So the conclusion from all this is that psilocybin is a promising new treatment for depression and anxiety. Although information is fairly new, multiple studies have found a minister's amount of psilocybin can cause decrease in depression and anxiety. Psilocybin is found to be one of the safest recreational drugs and is now being looked at continuously and studied to treat depression. Some key takeaways. Psilocybin is the active drug found within certain types of mushrooms. It works by mimicking serotonin receptors. Psilocybin has been found to be a successful candidate for treating depression and anxiety. It has been found to increase brain function of people suffering from depression and anxiety. And psilocybin has also been found to be a safe and effective drug for treating depression. Last thing is just my works cited.